My name is Irene McAleer. I'm a pediatric urologist at Children's Hospital Orange County, and today I'm going to discuss prenatal hydronephrosis. On prenatal hydronephrosis, the children generally don't have any symptoms. This is picked up during the pregnancy on the mother's ultrasounds of the fetus. As far as hydronephrosis itself, there can be symptoms if the child has a urinary tract infection or if they have obstruction with pain and discomfort. Occasionally urine output may be decreased, but generally that is not one of the symptoms. On a prenatal hydronephrosis patient, after the child is born, we generally get an ultrasound and make sure there aren't any serious conditions that need urgent surgical therapy. Most of them don't need any urgent therapy. Therefore, we would get an ultrasound of the kidneys and bladder shortly after the child is born. Occasionally, other studies will be needed, but generally we start with that and then might get the other tests based on the findings of the ultrasound itself. Generally, luckily, hydronephrosis is very common. It's about 1 in 500 pregnancies, and luckily 90% of those children with hydronephrosis will have resolution without any surgical therapy. There's only about 10% that will need to have something done. The long-term effects of hydronephrosis are very rare. Generally, 90% of these are going to resolve and without any kind of problem, without any kind of surgery. The 10% may have significant problems with their bladder and kidneys afterwards, but most of them, once they're corrected, will not have any problems.